Hey guys, this video is going to be about rehab for a total knee replacement. I'm going to go over the process in terms of what's going to happen in the initial phases of a total knee replacement when you're rehabbing it. And then the second part, I'll do another video which includes getting the majority of your strength back and getting back to full functional activity. So the initial phases of a total knee replacement, which usually it's in that first 1 to 4 week timeline, usually includes management of your pain, management of your swelling, restoration of your range of motion, restoring the function of your quadricep muscle, which is your thigh, and lastly, gait training. Let's talk about pain management first. So there's a couple things in terms of pain management. Usually your surgeon prescribes narcotics for you, so that would be pain medication. You would just use that as directed, and then as your pain starts to get less and less, and you would just kind of use that as needed. Another thing you can do for pain management is the use of ice for your knee. So usually in the beginning after the surgery, your knee's hot, it's red, it's inflamed. And because of that, it's gonna generate a ton of pain. I usually have my folks in the clinic ice for about 10 or 20 minutes. We have these ice packs. I put it in a pillowcase. These are the gel ones where I get from the freezer. I have them straighten out their knee, put it just right over it. If you have two, that's even better. You can put one underneath, and then you can put another one right above to be able to just sandwich the knee. I usually have my folks do this 10 to 20 minutes at a time, and then throughout the day, about 3 to 4 times a day. The last piece for pain management is doing some of the exercises either your surgeon or your therapist is giving you, because some of those exercises will involve stretches to help loosening up some of those muscles, or sometimes they teach you self-massage techniques to help also manage some of the tightness in the muscles, which then can also be a pain generator. Next, let's talk about management of your swelling. There's going to be a lot of swelling in your knee, mainly because you had surgery. Your body recognizes the surgery as trauma. It's going to try to heal, and as the process of healing goes through, then swelling will happen. Some of the things that we do with managing the swelling is, again, with ice. You have to add some compression while you're icing, and elevation. So the easiest way to do this is to lay on your back, and the amount of elevation that you need, it needs to be higher than the level of your heart. So the way I usually do this is I have a little bolster right over here in the clinic. When you're at home, you can use really just 1 or 2 pillows. Let's just say, for the sake of this, it's gonna be my left knee. Bring this up all the way so it's comfortable. Have the ice on it and a little bit of compression. Usually after the surgery, the surgeons will provide a compression stocking that goes around the knee, and that's something that you can use for compression. If not, you can order like compression stockings on Amazon, but most of the time, what I've seen through in the clinic is people come through with like a tan-like ace wrap that goes around the knee. Have that on, and then you can have the ice over it. Make sure you have enough ice because the ace bandage usually is thick, so you want the ice to actually get through and be cold. And you just lay back. That's how you manage the swelling. Because you're doing this with the ice, I typically have people go with the timeline of how long you usually ice to help with pain as well. The time that you're icing would still be 10 to 20 minutes. Same thing, about 3 to 4 times a day. That also helps with the swelling. And when we're doing this in the clinic, when I'm seeing my clients in the clinic, they're usually doing this at the end of the therapy session. So after all the exercises, after me stretching them, and then at the end, this is the time where they just hang out for 10 to 20 minutes with ice with the leg elevated. Another thing, if you are getting physical therapy in a PT clinic, the majority of the time, they will likely have this ice machine. It's called a Game Ready. This is very helpful to help with pain and swelling, because this is essentially a ice machine that holds ice, and you add a little bit of water in there. This machine takes cold water, kind of pumps it through this tube and goes into this sleeve, which then goes around your knee. So there's going to be a compression component that goes around the knee, and then it's also going to be cold. It usually feels very good for most of my patients, and the majority of my folks really like it. You can do this with elevation, and then you just have them lay back while you're doing this. This usually goes on for about 10 minutes, helps with swelling and pain very well. So if you're going to a PT clinic and you see that they have the game ready here, ask your therapist about it and have a conversation, see if that's something that would be appropriate for your knee. Let's talk about restoring range of motion. So let's talk about flexion first. To restore flexion, in the initial phases, I usually have my folks do a couple exercises. So the first one is a heel slide. All you need is a strap like this. This is called a stretch out strap. You can get this on Amazon. Hook this on the foot on the side that you had surgery on. Lay on your back, and we're working on bending. So what you're trying to do is use both your hands, pull this, go as far as you can go. What will stop you will either be pain or tightness. Once you get there, hold it for 10 seconds and then release. And you're doing this about 10 times. When you're doing this, make sure your hands are doing majority of the work. This is a passive exercise. Your legs are relaxed when you're doing this. Next one for bending is going to be a prone quad stretch. You need to be able to lay on your stomach when you're doing this. If your knee is sensitive because of the scar that's in front of your knee, what you can do is you can lay a towel or a pillowcase right in front, something soft. So when you're laying on it, whatever you're laying on, the scar won't be scratching on that surface. What you're essentially trying to do here is trying to pull as far as you can go. Bending that knee, try to bring your heel towards your butt. Hold it for about 30 seconds. And then you repeat for 3. And what's going to stop you is going to be either tightness or pain. Either of those, whichever one you hit first, that's where you start holding the 30 seconds. So the next one to work on bending, so for this left knee, is you have to sit up at the edge of this bed. So what you're going to do is, if you're sitting up at the edge of the bed, you take your other leg and then you push back as far as you can go. So this is a passive exercise, meaning this one's doing the most of the work, and then this one's just going for the ride, letting the right one push the left one. So assuming the left one is the side that you had surgery on. Hold it for about 30 seconds. Either pain or tightness is what's going to stop you. That's where you hold your 30 seconds, and then you slowly let go, relax, and then you repeat for a total of 3 sets. Last exercise is working on flexion while you're in weight bearing. So this requires a step. In the clinic, I'm using this step stool right over here. So all you're going to do, the right leg is the one that we're working on. So assuming this is the side we had surgery, all you're doing is lunging forward, getting to the point where either pain or tightness is stopping you. You hold this for about 30 seconds, and then you come back. If you can't hold it for 30 seconds because of pain, then 10 is what you're shooting for. And then instead of doing it 3 times, you're doing it for 10 times. So if you're holding it for 10 seconds, you're repeating it for 10 sets. If you're holding it for 30 seconds, then you're repeating it for 3 sets. Make sure when you're doing this, because you're working on the leg that's injured or the surgical side, what happens is when you are doing this, your balance might be a little bit off. I want you to have something to hold on to for stability's sake and just for safety. Moving on to the next component of rehab is working on extension, which is how straight your knee is. The first exercise to help with that is a quad set with your ankle propped up. I usually, in the clinic, I use something like this to prop up my patient's ankle. And essentially what we're doing is you're squeezing your quad muscle, push down, and when you push down, you engage the knee into extension, because that's what the quad does, it's a knee extensor. Hold it for about 5 to 10 seconds, and then you repeat for 10. And then you relax. So 5-second push down, 5-second hold, and then you relax. So what you're trying to shoot for is taking this knee and pushing it down so you can achieve a straight leg. A simple hamstring stretch is a nice way to work on knee extension. So you just need a strap like this, like the one you did with the heel slide at first. Hook it around your foot and ankle, and you just pull it up. Get to the point where either pain or tightness starts to come on first. The majority of my patients tell me that tightness is usually what comes on first. Once you get to that point, hold it for about 30 seconds. You should feel the majority of the tightness in the back of the thigh here. The other thing is when you're doing a hamstring stretch, try not to bring it up with the knee bent. I understand after a total knee replacement, the majority of time the knee is a little bit bent because there's a joint restriction within the knee or the swelling. So keep it as straight as you can, and just making sure that you feel it in the back of the thigh here to ensure that you're stretching out the hamstring. 30-second hold 3 times here, and then you just relax and you move on to the next thing. Another nice passive exercise to help with knee extension is to what I call a supine knee prop. So what you do is you prop up your ankle with a little bolster like this. It could be a pillow, anything, just as long as there's a little bit of space underneath. You can even do this sitting up with your leg propped up on a chair. What you do need though is a little bit of weight. So I have a 5-pound ankle weight here. Put it on top of your kneecap, not directly over the knee, but on top of it, and then you just hang. The principle here is low load, long duration. So what I've seen in the research is probably about 15 minutes, 4 times a day, coming up equivalent to an hour. So usually when I have people do this, they're just playing on their phone. And the majority of the time I have them do this 1 or 2 times in the clinic just to make sure they're doing it correctly, and then they're doing this at home. You can lay while you're doing this, you can sit, you can play on your phone, whatever, just as long as your knee is being pushed down. Another thing to take into consideration is make sure your foot is not turned out this way, because if that is the case, the direction of the push from the weight is not actually down. So you want the toes to be pointing upward or the knee joint to be facing upward. So when the weight is on it, the force vector is pushing the knee into extension. Last exercise to help with knee extension is what we call a terminal knee extension. So you need a power band, something real thick and strong like this. Hook it up to something stable. This could be the back of a door. All you got to do is just tie a knot, throw it on the other end of a door, and then close it to help stabilize. Make sure it's at the level of your knee. So what you do is put it in the back of your knee and then walk backwards. You can use like a chair. I have something here for balance. And you're putting the majority of the weight on the left leg here, because we're pretending this to be the surgical side. You're allowing the band to pull, to bend the knee, and then you are pushing back, kind of like a quad set, what we were doing on the table, holding that here for about 5 to 10 seconds, and then repeating for about 10 to 20 times. So you let this, as you relax, allow the band to pull, and then you resist. As you resist, you're engaging the quad muscle. Hold, and about 10 times, 20 times, depending on what you can tolerate. And that's the last one for knee extension. Next component we're going to work on is restoration of the activation of your quadricep muscle. This is one of the most important muscles after a total knee replacement, because it is involved in holding you up and involved in walking and doing stairs and squatting and things of that nature. Very important for daily functional activities. So to engage the quad, you actually already know this exercise. It's the quad set, but the quad set also works your knee into extension because it is a knee extensor. So to review this quad set, you can do this with the knee propped up to work on knee extension, range of motion. You're still holding it for about 5 to 10 seconds, repeating for about 20 times. This, as you engage your quad, it pushes your knee into extension. Therefore, you're working extension, range of motion, and you're also working on activation of the quad. If, for whatever reason, you don't have the full engagement and you just want to work on the engagement of the quad without working on range of motion, you can put a little towel underneath here and just push down, so there's a little bit of feedback when you're engaging the quad. Usually when I'm doing this in the clinic and for practical reasons, I usually prop the ankle up, so I'm working on range of motion and quad engagement. Next exercise for activation of your quads is what's called a short arc quad. You need a bolster like this underneath your knees. So what you do here, very straightforward. You just straighten it out, point your ankle towards you, really focus your mind and attention on squeezing your quadricep muscle here. Hold it for about 5 seconds and repeat for 20 times. And then relax, and then you would bring it right back up. The focus here is try to extend your knee, get it as straight as possible, and really feel the squeeze and the burn when you're doing this in your quad. Long arc quads is after short arc quads. So this next one, you're sitting at the edge of a table, and then you are pointing your ankle towards you, kicking up, straighten out your knee as much as you can, squeeze the quad muscle, 5-second hold, 20 times, and then you relax, and then you repeat. Make sure you engage the quad. You can palpate your own thigh muscle here, make sure it's nice and tight, and then let it go to ensure that you're activating it. Last exercise for knee extension is going to be what's called a straight leg raise. This is what the previous 3 should build you up to. And if you can do this exercise, you really shouldn't be doing the previous 3 because those 3 are prerequisites to this exercise. So a straight leg raise looks like this. You lay on your back, have the opposite knee bent just to help protect your back. Point your ankle towards you to generate tension in the left leg, and then lift it up to the height of the other knee. So the whole thing with a straight leg raise is you want this entire leg straight. The majority of the time, in reality, what I see in the clinic is there's usually a little bit of a bent, and then people lift it up. So as long as you ensure that you are putting maximal effort in straightening out that knee, then we are doing okay. Because if there, usually after a knee replacement, there is an extension range of motion restriction in the knee. No matter how much you try to strain it, if you still have that extension range of motion in the knee, it's going to be hard to do so. And that's on your therapist to be able to help loosen it up with their hands on, either with a joint mobilization or loosen up the muscles in the back of the knee or the front of the knee or really all around it to help facilitate full extension of the knee. So again, you want to point your ankle towards you, lift that up. This one, you don't really need to hold. You just tap the heel back onto the table. And then I usually have my folks knock out reps when we're doing this. So for a total of 20 or for a total of 30, once this gets easy, I put an ankle weight on the ankle, starting with a 1 pound and going all the way up to a 3 to 4 pound. The last piece to this video is gait training. So that talks about walking and your ability to generate a symmetrical gait. So in the beginning, you're likely going to be using a rolling walker or a cane. So I'll talk about both of those. So with the rolling walker, you want in terms of adjustments and how it fits you, you want the handle at the height of your wrist line. So if you're standing straight up, so this handle should be at your wrist. And in terms of how far you're going to be just about, your feet's going to be just about where these back legs are. You can't be too forward, nor can you be too far. Because what happens is if you're too far, you have to be leaning forward, and it's going to be hard for you to stop. And if you're too forward, it's hard for you to push the walker forward. In order for you to brake, if you're going forward and you want to stop, you apply pressure downward. Because when you apply pressure downward, the forces will go through the back leg because there's only wheels in the front here. So this is a rolling walker with 2 wheels up in the front. And when you're going forward, remember not to push down on the walker because then you'll be braking. You want to just go ahead and push straight forward, and you try to walk normal with it. Usually people progress fairly quickly out of the walker. Usually it's a couple of weeks. Once you feel more comfortable and more confident with your knee and it gets a little bit stronger and your quads engage, you can progress off the walker and go onto the cane. The concept of the cane for fitting is similar to the walker in terms of the height. So the handle has to match your wrist line. So if you had a surgery on the left side, you're holding it on the opposite side, so it's going to be your right side. And when you walk, the purpose of the cane is to help counterbalance. Once the opposite leg is up, that's when the cane goes, and then that will give you counterbalance when you're walking. If you're holding it on the same side, when you're going, you're balancing on the wrong side, so it's not giving you as much support as possible. So it still gives you a little bit of support, but it's not optimal. Once you feel pretty comfortable with the cane, then it's time to progress off the cane. The majority of the time when you're walking with a cane, you're demonstrating a reciprocal gait. Reciprocal gait meaning 1 foot over the other, kind of like walking normally. Once you're getting off the cane, then it's time to work on your normal gait. To work on your normal gait, I keep it very simple with my folks. I just tell them heel to toe. So when you're walking, you want to make sure the pressure you start off, the first thing that hits the ground is going to be your heel. You're rocking through the bottom of your foot, maintaining pressure on your foot, and then rocking off your big toe. Hopefully that was informative and that was helpful and helps your rehab process a little bit smoother in terms of your total knee replacement. This is going to be part 1 of this video. I have another video coming up that's focused primarily on strengthening after you restore your range of motion, brought your pain down, your swelling is managed, and your gait has been normalized. All right, that's all I have for you guys. If you have any questions, please leave them in the comment section below, and I'll see you guys in part 2 of this video. Thanks for watching.